Okay, you guys, we are here with Raquel, and she is doing a full face correction with filler. So go ahead and tell us what that means.
All right, so Candace is here today. She happens to be an athlete, so she is a lean woman, and lean or not, as we age, we lose the good fat in our face. That is the first to go, unfortunately. So full face correction, when looking at her, obviously she's beautiful and young, and it looks like she doesn't need anything at all. But if we look closely, there are areas of deficit, just from her training, from being super lean, where she's starting to notice that, what did you say, you're starting to feel like you look a little more tired.
Right.
So when I look at her, I've noticed that her tear troughs are just slightly empty, and she's starting to notice a little depression there. And then she feels like her cheeks are kind of falling because she's used to having more full cheeks. So what we're going to do with the filler is we are just going to slightly augment those areas, and we're aiming just to correct deficit. So that's one of the biggest misconceptions with filler. We don't want to make her look crazy different or fake or too much. All we want to do is replace volume that she has lost through hard training and aging. So what we're going to use is a couple of different kinds of fillers. How I choose which ones I'm using depends on the part of the face I'm filling. So in the under eye area, that's always going to be Restylane. It settles best there. And then the cheeks, we're going to use Voluma, which is a great filler to kind of pop up the cheeks and give a little bit more of a cheekbone and a lift in this area to kind of pull everything back up. All right, so I've already cleaned and prepped her skin. I'm going to start with her tear troughs. We're going to use some Restylane. I'm using the cannula technique. The cannula definitely cuts down on bruising and swelling. So I'm going to have you close your eye for me. I'm going to give you just a little pinch here. Little pinch. Like I said, I'm using Restylane. This lasts about a good year or so. Okay, so you feel just a little bit of pressure. And I'm going to have you look straight ahead for me. Perfect. So we're just going in and topping off this trough, which is very mild, but it's going to make a big difference. I'm just going to add one drop more, and then we're done on this side. You okay? Perfect. Okay, so I'm going to have you just hold a little pressure right there for me. Okay, moving to the other side. Okay, close your eye for me. Little pinch. Perfect. Okay. So the cannula is a blunt tip, not a needle. So that allows us to treat this under eye area with really minimal bruising and swelling. It's also very safe and a lot more comfortable. Look straight ahead for me.
Yeah, I mean, I don't feel anything.
Good.
Like at all.
That's good. And we put a topical numbing cream on before we started, so that really helps as well. Okay, lift up on this side for me. Perfect. Okay, hold just a little pressure over here. So that is it for the tear troughs. It's pretty quick.
Marty Wayne says Raquel Frisella is the best.
Aw, I love you, Marty.
Okay, what's your next step here?
All right, so next we are going into the cheek. And we are just going to lift the cheeks back up a little bit and add a little bit in the lateral cheek, and that's going to give her that sexy cheekbone and just some lifting. Replace some volume that she has lost. We want to see what we call the OG curve in the cheek, and that is the aesthetically pleasing cheek where we're going to see it go in, come out, and go in again.
So this one is a needle then?
This is a needle that I'm using here in the cheek. Sometimes I do use the cannula in the cheek. It just depends on my patient and what I'm going for. This is Voluma. It's definitely my favorite product in the cheek. It has a lot of oomph. It lasts a good 18 to 24 months.
You seem to be really numbed up.
Oh, I cannot feel anything like at all.
That's good.
Okay, great. Hold just a little pressure there for me. Okay. Let's be down for a second. Okay, I'm gonna get one more puff right over here. Pretty. So I don't know if you can see that on the camera. That
Yeah,
nice
that lift,
definition
yeah.
and lift that gives. Pretty. Okay, hold just a little pressure there. One side down.
One side down.
One to go.
I mean, it's great when you can't feel anything.
All right. Julie B. What's
Hi.
up? Okay. So let's take a peek. So if you look straight on, you can see the difference here where this side is just a little more flat and here she is more lifted. And these are the types of subtle changes that prevent aging and just make a big difference. You want to hold pressure on that side?
Julie B here,
Hi.
joining us. Okay, so for everyone, looks like we have a couple more people looking or viewing us. So go ahead and remind us what we're doing right now, Raquel, or what you're doing.
We are doing right now Voluma into the lateral cheek for some lift and to create some more dimension.
And for anyone who missed it, we did Restylane for the trough fillers just a little bit ago.
Looks good. Looks so good. Okay, just a little bit more. And you can just see that cheek pop right up. Okay, let's see. Yeah, just a tiny bit back here. Okay. Pretty. Okay, hold just a little pressure over here for me. Okay, and then we are going to top off the nasolabial fold and then add just a tiny little bit into the upper lip. And that will complete our full correction. So the cheek is great because a lot of times when we correct the cheek, we really don't, it eliminates or reduces the need for filler in the nasolabial fold. So I'm literally just going to put a tiny bit right here in the deepest part of her fold because I feel by treating her cheeks, we were able to correct the fold. When we lose volume here and the cheek falls, a lot of people start to feel the heaviness in the lower face and the fold. So that's why we want to start with the cheek, correct the volume loss, lift everything up, and then kind of go from there. Okay, and then open up just a little for me. So we're just adding this a little bit of volume into her lips, a little definition. So So when she puts on a lipstick, it'll be really defined and just kind of pop.
That one hurts a little bit more.
We'll take a break. Okay, hold a little pressure there. Let's see here.
Now, are there parts of the face that are a little more tender than others?
Yes, the lips are, I would say, the most tender. We do numb really good, but even still, sometimes you feel that a little bit. Okay, open just a little bit. Okay, let's see. And her bottom lip is awesome, so we're good there. Perfect. Okay, we are all done for today. So I'm gonna have you hold just a little pressure on the lips for me for just a second. So aftercare instructions, we give you ice up 10 minutes at a time when you can over the next 24 hours. Drink a lot of water, stay hydrated, try to sleep slightly elevated. We'll see you back in about 2 weeks for a touch-up if we need to do that. And then other than that, it's just a little bit of a healing process. You can have some bruising and swelling, although things are looking good now. It doesn't look like you're gonna have too much bruising. But you do always want to plan for just a couple of days for potential bruising or swelling. How do you feel?
Good.
Okay, so anybody else watching this video later, if you have any questions, go ahead and throw them in the comments and we'll make sure that Raquel is able to answer them.
Absolutely. You were such a good sport. You did great.